Hi, this is Amy and welcome to Chair Yoga for Seniors. Today's video is going to feature upper body exercises that you can easily do from home. One prop that I'm using is an exercise ball. It's about 8 or 9 inches in diameter, fairly squishy. A lot of times you can find one online as a therapy ball or a small Pilates ball. If you don't have one of these at your home, you can also use a slightly deflated soccer or volleyball, although you probably don't want to use them for part of the exercises in which we compress the ball, but I'll cue you on those. And as always, please be sure to consult your physician before beginning this or any exercise routine. All right, let's go ahead and go to our chairs. We're going to start with the ball on the floor and just begin with a gentle warm-up. So I invite you to sit back in your chair for a moment. Just going to connect with our breath, bringing our hands into our lap and closing our eyes. Take some slow, deep breaths in and out through your nose. Allow your chest to expand as you inhale and relax as you exhale. Have the intention to take full, deep, complete breaths. Exhaling and emptying the lungs as completely as possible. And on our next exhale, lowering the chin downward towards our chest. Opening our eyes and lifting our head back to a neutral position. All right, let's go ahead and sit forward in our chairs. Starting by just warming up our shoulders, we're going to roll the shoulders up and then squeeze the shoulder blades towards each other as you roll down. Inhaling with our lift, exhaling with the lower. And now bending at the elbows and just closing and opening the hands. Last one. And now rotating the palms facing the floor, and then rotate the palms back towards the ceiling, rotating inward and outward. And leave the palms facing up. Now fingertips up towards the sky and palms away from you. Last one. And relax the arms back down. Now we're going to sweep the arms up towards the sky, just moving as high as you're able to without pain. If you've got a shoulder injury, maybe not taking that particular arm up quite as high. Inhale, lift. Exhale. 2 more. Last one. bring our hands to our shoulders. Just kind of loosening up the torso a little bit. We're going to do a little twist to our right side. Exhale, twist to the left. Inhale, twist and gaze to the right. Exhale, twist and gaze to the left. Really focus on the twist coming from the rib cage and up into the shoulders. One last time. And come back to center. Let's go ahead and bring our hands onto our laps. Working through our spine a little bit more, just kind of stretching those muscles surrounding both sides of the spinal cord. Take a deep breath in. Lift the chest. I'm going to turn sideways so you can see. You're going to let your hips tip back a little as you lift your chest and lift your chin just slightly, breathing into cow. And then as you exhale, stretch, pull your belly button towards your spine. Take those shoulders and scoop those hips forward into cow. Inhale, lifting back to cow. Exhale, cat. Deep breath in. Exhale. Really fill the lungs. And one last set. Lift your chest, come back up to center. All right, let's go ahead and take hold of our exercise ball if you've got one. We're going to start just by extending the arms forward and bringing it back in, breathing in as we extend forward. Exhale as it comes back. One last time. And now straight up as high as you can reach without pain. 5, 4, 3, 2. Last one, hold it up here. Now moving into a tricep dip. And if you're not right overhead, maybe you're down here. That's perfectly fine. We're still going to bend right at the elbows and dip the ball either towards the forehead if you're in front of your head or behind your head if you've got the ball fully extended overhead. And back up. Exhale, lower down, activating right through here. Inhale, lift. Exhale. And up. 5, 4, 3, 2, last one. All right, let's bring the ball back down, give our shoulders a little rest for a moment. We're going to take the ball into the right hand. Now, if gripping the ball single-handed is not possible, this you can do with an open palm and just rest the ball in your lap. So you're going to take it into the right hand and we're going to twist it like we're trying to turn a doorknob. 4, 3, 2, 1. Now pass it to the other hand. Take a good grip and twist. 7, 6, 5, 4, 3, 2, 1. All right, now I'd like you, if you have a ball, to place your thumb on one portion of the ball and your index finger on the other. If you don't have a ball, you can have an empty hand. You're just going to touch one finger at a time to your thumb. If you've got the ball, you're going to pull your fingers along the ball one at a time to make contact with your thumb. Let's do 2 full sets. So all the way down to the pinky, repeating the pinky twice, and then back to the index finger. All right, switch to the other hand. Same thing, pulling one finger at a time towards your thumb. All right, good job. Now let's go ahead and take the ball into both hands, bringing the right hand on top, left hand on the bottom. We're going to squeeze the ball firmly and give it a little twist like you're trying to open a brand new jar of pickles. Last one, bring your other hand on top. Four, three, two, one. All right, now bring both elbows down beside your body. Again, if you aren't using a ball, you can have your palms open, facing up for this exercise, and just rotating out to each side. Notice that my elbows are staying really close to my rib cage because we're wanting to work on our external shoulder rotation. So we're just going to rotate, ball out to the side, pass it across, and out, and pass. Two more sets. Last one. All right, good job. Now bring the ball out between both of the hands. We're going to take a deep breath in. Again, if you have a soccer ball or a volleyball, this may be one of the exercises that you want to kind of set the ball off to the side. You're going to contract your bicep muscle, this muscle right here, and just kind of press the air without touching your hands together. If you've got the Pilates or therapy ball, we can take a deep breath in to start, and then we're going to press on the exhale. Inhale, relax. Exhale, press. Now, the breathing on a lot of the exercises isn't so important, but on any kind of what's called an isometric contraction, you want to be exhaling on that contraction because that's kind of forced tight muscle movement can actually cause a blood pressure elevation if you're inhaling as well and kind of trapping your breath. That's why we want to go ahead and take that moment to breathe out as we press. 3 more to go. Last one. All right. Now take your ball, and we're going to bring it underneath the arm. Again, if you have a larger ball, if it's really deflated, it's safe to do it here. It may be a little uncomfortable. The other thing you could do is maybe a little pillow right here as a spacer. And we're going to breathe in to start, and then exhale, contract the muscles, squeeze into the ball or the pillow. You're going to feel your pectoralis muscle right up here contract. Inhale, relax. Exhale, squeeze. One last time. All right, take the ball or your pillow, bring it underneath your other arm. Breathe in to start. Squeeze as you exhale. One last time. All right, let's bring the ball back to center. Now moving into some wood choppers, we're going to take the ball and reach diagonally up to the right, and then twist just a tiny bit and bring the ball down by your left hip. Inhale, lifting up. Exhale, come back to center. 4, 3, 2, last one. Back to center, other side. Breathe in, exhale. Four, 3, 2, last one. All right. Now, part of our upper body is also our core. So we're going to do a few core-centric exercises here. So you can either take the ball or set it back down on the ground. If we're going to use the ball, we're going to bring it in between our legs, just as kind of a little spacer here. I want you to sit back a little bit further in your chair. Make sure your hands are beside your chair so that if you lose your balance, you've got something stable to hold on to. We're going to breathe in, lean the shoulders back a tiny bit, and try to come up on our tiptoes. And slowly come back up to center. Breathe in, lean back, come onto the tiptoes. And back up. So you should feel the core muscles engaging. Shoulders back slightly. Keep the core nice and tight. We're going to make sure as you're leaning back that we're taking the shoulders back. But notice the spine stays elongated. If you're leaning back and you feel like you're jumping down through here, keep the sternum lifted. That's going to prevent you from rounding the low back. Let's do 3 more. 2. Last one. And come back to center. All right, good job. All right, now we're going to step our left leg diagonally out to the side. Bring the ball or just an empty hand onto the right shoulder. Going to do a little twist. Exhale, come across the body. Inhale up. As you exhale, imagine someone trying to poke you in the belly button. You're trying to pull your belly away. And up. Exhale. Breathe in. 4, 3, 2, last one. Step your leg back in, pass the ball over to the other shoulder, or again, you can just have a hand on the shoulder by itself. Step out diagonally, twist, leg across, core stays engaged. Inhale up. Use your breath. Exhale. 4, 3, 2, last one. Come back to center. Now just a little bit of eye-hand coordination. If you don't have a ball, maybe a very small, lightweight pillow, maybe a hand towel or a washcloth, something that you can toss and catch. You're just going to toss it and catch it a few times. Make sure you're not throwing so high that you're having to crane your neck to keep visual contact with the ball. 4, 3, 2, 1. All right. Let's go ahead and take the ball now, bring it onto the right side, or you can just gently place your hand. If you're not using the ball, as you hinge to the side, we're going to slide the hand to the tip of the knee and come back up. If your arm is on the ball, we want to make sure that the wrist is off of the ball a little bit, and the majority of the ball is situated right on the forearm area. We're going to lean into the ball a little bit, hinge to the side, keep the core engaged, inhale back up. Hinge to the side, so we're contracting the obliques on this side and we're lengthening on this side. And up. 6, 5, 4, 3, 2, last one. Step the leg back in, other leg out, ball on, or arm on the ball, or hand on the leg and sliding back and forth. Here we go. 8, 7, 6, 5, 4, 3, 2, 1. All right. Now we're going to do some full arm extensions, either gripping the ball, overhanded grip, or our hand can be empty. We're going to bring the ball down beside the body. Inhale, lift, and slowly lower. Inhale up, exhale down. 4, 3, 2, 1. Now bring the ball back down by your side. Turn your palm facing forward. Moving into a little bicep curl, we're going to bring the hand or the ball up towards the shoulder and then slowly extend it down. And as you're extending, contract your bicep. Breathe in, contract that muscle. Exhale, tighten it as you extend back down, as if that ball or your empty hand, pretend it weighs 15 pounds. And down. 4, 3, 2, last one. All right, now switch to the other hand. Again, we're starting with the palm facing the floor. Bring the ball beside you. Inhale, lift shoulder height. Exhale, lower. Inhale. And 4, 3, 2, last one. Rotate your palm to face forward, contract the bicep, curl it up to the shoulder, and slowly back down. 5, 4, 3, 2, last one. All right, good job. Now, if you have a ball, this is the best part. We're going to take it, we're going to place it into the lumbar curve of the spine, right above the hips. Sit back against the ball. Now, if you don't have a ball, you can kind of take your thumbs and do a little circular massage in the low back area. But you're just going to rock from side to side a little bit, letting the ball massage and roll back and forth across your low back. All right, now let's go ahead and take the ball, set it back underneath our chair. Make sure it's out of the way and you know where it is so when you stand up, you don't accidentally get it underneath your feet. Let's sit all the way back in our chairs. Before we take our final relaxation or shavasana, I want to do one quick breathing exercise just to kind of clear everything out, all the tension. So what we're going to do is sip 3 breaths in, and then 1 big breath out. Let's do that again. Sip in. Exhale fully. One more time. Sip in. And exhale. Good job. All right, relax your shoulders against the back of your chair. Bring your hands to your lap or down by your side. Close your eyes again. Start to take some slow, deep breaths in and out through your nose. As your mind is beginning to find itself coming to a place of quiet, I'd like you to visualize a clear blue sky. After you've painted that blue sky in your mind, start to visualize some white puffy clouds. And as you breathe in, just noticing those clouds floating by, and as you breathe out, let them leave your view. Inhale, ushering more white clouds into your view. And exhale, letting them clear by, creating blue sky again. Now take a deep breath in. Let your mind clear completely. Let the sky go blank again in your mind. Lower your chin slowly down to your chest. Holding here for a moment, relaxing the muscles along the back of the neck. Let's roll our right ear towards our right shoulder, releasing any tension that we may have created in this upper trapezius area. Exhale, chin back to chest, and left ear towards the left shoulder. Come back to center. Open your eyes, lift your head back up. Thank you so much for joining me today for Chair Yoga. Hope to see you again soon. Have a wonderful day.